With so much focus on a COVID vaccine, other shots are being forgotten. Tonight, local physicians are urging parents to stay up to date on their child's shots or risk another pandemic from a disease that we thought we had under control. Here's KCTV5's Amy Anderson.
COVID-19 has been bad enough, but the last thing we need is a resurgence of diseases that vaccines had already crushed. But tonight, doctors are warning if we stay on the path we're on, that's exactly what could happen.
There's been a lot of time outdoors, a lot of time exploring bike trails we've never been on.
For Paul Size and his family, the pandemic brought lots of new adventures and so far, no trips to the doctor.
It's not a single sniffle, not a cough, just nothing at all.
That is certainly one plus of the pandemic and one so many parents have noticed and are grateful for.
It is kind of weird. Normally, sometimes, they have allergies or they get sick, but they haven't really sneezed or anything throughout this entire spring, even though we're moving into the summer now. It's strange,
But fewer trips to the doctor, whether due to offices scaling back on the number of patients they see or because parents are leery of exposing their child to COVID-19, could lead to trouble down the line. Here in the U.S. and around the world, the number of children getting critical vaccines has plummeted. You can see the results of the study published by the CDC. And the World Health Organization warns some 80 million babies are at risk of diseases like diphtheria, measles, and polio.
We've got to keep 90 to 95% of the population vaccinated to keep herd immunity in place.
Dr. Stephen Lauer with the University of Kansas Health System says it's a real concern, and he and other pediatricians are seeing numbers drop here locally as well. He says he understands why parents may be hesitant to visit the doctor's office right now, but wants to help spread the message it's actually very safe and everything that can be done to protect children in the office is being done. In fact, it may be even safer than it was before.
Parents and kids are not waiting in the waiting room anymore. They're going straight into a room. We're doing everything we possibly can to have them just go into that room, have the whole visit happen right there, and then have them leave. So they're not going to be exposed the way, frankly, you have been in the past. Sitting in the waiting room has been a bad place to sit.
While the rate of all vaccinations has dropped, it's children over the age of 2 that are being left behind the most right now. And doctors say it's critical they get up to date on their vaccines, especially before school starts.
The real worry is that if we don't do this, if we don't keep up the vaccination rates while we're fighting COVID, we're going to see an increase in these diseases that haven't been around in a couple of generations.
Parents we talked to say they've been extra careful with COVID-19 around and say they have no plans to forego any doctor appointments.
And I feel like the doctor's office is probably cleaner than a store. So, and it's important to get those checkups and those vaccines. So, and I know they're being very cautious.
You shouldn't be nervous, You take precautions for yourself and your baby, and then just call and make sure your doctor's office is taking those precautions as well.
I have good faith in the doctors that we have here, and I trust them, do the right thing, and to have a safe, healthy environment for my children.
And that's a good thing because those diseases, while thankfully rare, are not gone.
Diseases are still there. They're a plane ride away from people in the U.S., and we're all at risk for those becoming common diseases again if we don't keep up the vaccination rates.
Amy Anderson, KCTV5 News.